Good morning. Myself Varun Kumar, I'm faculty, SNS College of Physiotherapy. Today we are going to see about the breathing exercises. So breathing exercises, it's a group of therapeutic exercises which is designed to improve the ventilation, oxygenation, chest mobility, respiratory muscle strength, and as well as the breathing efficiency. So they are an integral part of cardiorespiratory physiotherapy, and it's used for both preventive and as well as the rehabilitative care. So aims and objectives of the breathing exercises. So the aim of the breathing exercises are to improve the pulmonary ventilation and to prevent the pulmonary complications and as well as to promote the efficient breathing patterns. So objectives of breathing exercise are to improve the lung expansion, to reduce the work of breathing and to strengthen the respiratory muscles, enhance the oxygen exchange and to facilitate the secretion clearance and also to promote relaxation. So these are the basics, aim and objectives of the breathing exercise and also the essentials of breathing exercise for what and for why we have to give the breathing exercises. So the physiology of normal breathing. So physiology of normal breathing, inspiration, active process, which is the breathing normally taken by the patient or a person themselves. That's the active process. And while during the inspiration, diaphragm contracts and descends, whereas the external intercostals elevates the ribs and this process involves the inspiration to occur. Whereas in expiration, which is the passive at rest, elastic recoil of lungs and chest walls. Both the inspiration and expiration is controlled by the medullary respiratory centers, which is called as the chemoreceptors, which involves carbon dioxide, oxygen. So where the oxygen involved in the inspiration, whereas the carbon dioxide comes out or exhales out during the expiration. So while in breathing in the trachea, while the air is entering into the trachea and then it entering into the lungs, where the lungs is getting expanded and diaphragm is getting promoted upward. Whereas in breathe out or exhalation, the lungs is getting shrinked, diaphragm is coming shrinked, then the air is coming away from the trachea. So types of breathing exercises. So in physiotherapy, there is a various types of breathing exercise which involves the improvement for the patients. One of the breathing exercises is diaphragmatic breathing. It's also called as the abdominal breathing. So it's a breathing technique that emphasizes the use of diaphragm rather than the accessory muscle. So the main concept is to use only mainly the diaphragm muscle, and also we have to avoid the accessory muscle usage. So the procedure. So patient should be in lying or sitting position. The patient should keep one hand on the chest and one hand on the abdomen. Then ask the patient to inhale through nose. While inhale through the nose, the abdomen will rises or diaphragm is rises. That we have to feel by the hand placed on the abdomen. While exhale through the mouth, the abdomen goes further falls. The advantages of this diaphragmatic breathing exercise it helps in reducing the accessory muscle activity. It improves the ventilation in basal lung regions and it helps in to decreases the work of breathing. So indication of breathing exercises are COPD conditions, asthma condition, post-operative patients and also patients with the anxiety disorders. So next type of breathing is the segmental breathing. So the segmental breathing name itself is saying we have to focusing on the segment of the lungs. So the segmental breathing exercise is the breathing exercise which is directed to specific segments of the lungs which can be using the manual facilitation. So before that, we have to know about the types of the segments. So in the types, there is the upper costal, lower costal, lateral costal, and then the posterior basal breathing. So the procedure, the therapist should places the hand over the targeted segment, either upper costal or lower costal, lateral costal or posterior basal breathing. The therapist have to place the hands over the targeted segment, and we have to give a gentle pressure during the expiration, and also we have to provide resistance during the inspiration. So this is the basic concept of segmental breathing. So the benefits of segmental breathing are to improve localized lung expansion, enhances the chest wall mobility. So next type of breathing exercise is thoracic expansion exercises. So these are the deep inspiration followed by the relaxed expiration, which increases the lung volume. So techniques uses the slow deep inspiration, hold for the 2 to 3 seconds, then relaxed expiration. First relief breathing. So it's a controlled expiratory technique to maintain the positive airway pressure. So procedure involves inhale through the nose, exhale slowly by using the lips as the pursed one. So advantages are prevents the airway collapse, improves the expiration and reduces the dyspnea. So paced breathing. So it's a synchronization of the breathing with physical activity. So example, inhale for 2 steps, exhale for 4 steps, usually during walking or stair climbing. So glossopharyngeal breathing. So it's also called as the frog breathing, where the air is forced into the lungs using the tongue and the pharyngeal muscles. The indications are eye spinal cord injury, respiratory muscle paralysis. So the general principles of breathing exercise are comfortable position for the patient, relax the environment, avoid the fatigue, proper therapist position should be instructed, then monitor the vital signs, then progress the gradually. So the indication and contraindications. Indications are post-operative thoracic or abdominal surgery, COPD, asthma, pneumonia. Whereas in the contraindications, severe respiratory distress, unstable cardiac conditions, acute pulmonary embolisms. So advantages of breathing exercise are improved oxygenation, reduces the dyspnea, prevents the respiratory complications, enhances the functional capacity, and thus it improves the quality of life. So, certain in case assessment. Okay. Thank you.